the app which gives patients control over the storing and sharing of their healthcare data, the glamping pod business which is offering a profit share to landowners across the country, and a tech company which is enabling businesses to measure the effectiveness of their marketing spend across all online channels. Good morning, I'm Karl Fitzpatrick and welcome to Business Matters. Well, healthcare data contains all of our most intimate details, but how can we store and share this data in a way which both simplifies and enhances engagement with healthcare practitioners? Well, my first guest, Richard Egan from Cushla, has the answer. Richard, we'll be discussing your business Cushla, but first, I'd like to discuss your career to date and, in particular, your time with VHI.
Yeah, you probably picked the accent isn't too local to Dublin anyway. I'm originally from Leeds, but I moved to Ireland in 1997. There wasn't too many Egans back in Leeds. We were only on loan for a few generations, so it's good to be back. But yeah, when I moved over first, I started with Citibank. I was there for 17 years, and then predominantly in the kind of transaction space and liquidity and investment operations, and that's where I kind of got a sense of the open banking and things that have led to Cushla. Joined VHI in 7 years ago, and it was kind of heading up the change delivery function, which was part of IT, and was there. It was good. It was there for a while, and I suppose around the time that I joined VHI, I also was invited to join the board of the Faculty of Sport and Exercise Medicine, which is part of the Royal College of Surgeons and Royal College of Physicians. So two very different lenses within VHI. It was very much the insurance business and a company that was trying to move into much more the provision of healthcare and the extension of the Swift Care services, which they're doing really well at the moment. And then on the other side with the faculty, it was a voluntary role there as a lay member, and that was really where the genesis of Cushla really kicked in.
So what is Cushla and what services do you provide?
Cushla is a product that just really improves the dialogue between patient and practitioner. And if I explain that, at the moment, there's lots of talk about, and the HICWA report, I think, has triggered a lot of conversation in the last week or so. Access to data is really, really important. And at the moment, very few people have access to a lot of data. It sits within the facility, so it could be in the GP practice system, it could be in the hospital system, and so on. And bringing that data to the practitioners that are treating you in different facilities is really, really important. But having the data isn't the real problem, and we've seen a lot of this out of the US, particularly where they've brought in the legislation over the last couple of years to make data available. And the unintended consequence of that is that those practitioners are now getting really thick print-out bundles of every consultation note from every facility that you've attended, and it's just too much, and the practitioners are spending twice as long reading the data as they are being able to interpret the information, and they're getting very stressed and burnt out as a result of that. And what we're trying to do with Cushla is just improve the dialogue between you and your practitioners. If we can bring that summary of your history together, both your medical history, some of your personal information, but importantly your lifestyle and your activity information, and we can present that in a nice and easy to consume way, it means that the bulk of your interaction with your consultant or your practitioner, whoever it is about treatment and recovery, not about fact-finding and data capture.
So how does Cushla achieve that?
So we've a couple of things, and I alluded to there the different frameworks in different countries. So if you take where we think this is going and where a lot of the evidence today is showing us that the market is going, it's about similar to the way that banking moved in over the last 5 or so years. If you walk into any consultation, whether that's a GP, a hospital, a physiotherapist, opticians, whatever, you'll get a copy of that treatment summary note as you're leaving, and it'll pop up like Revolut tells you've just spent some money in the cinema. You'll get a pop-up to say a record has been shared with you into Cushla. So we've a couple of ways to do that. The first is where the system that we're receiving the information from is a fully modern API technology, and by that I mean you can get information directly from the source system into Cushla without the human having to do anything. And that's the model that's in the US there. So that means within a few seconds at the end of the appointment, we look for a treatment note linked to you as a patient with your particular patient ID. And there's an authorization piece there between you and your healthcare team, similar to you having a password for your online banking. That recognises a consultation has happened, and it sends that information in, and that could be treatment notes, it could be scan results, blood test results, whatever. In the interim, though, and again, that's down the road, we've only one system that works that way in Ireland at the moment. We have other systems that have their own way of exchanging information digitally, and we can capture that as well, and we have a couple of systems in that space. And then we've got machine-readable documents that you receive via email. So that traditionally people go into a GP, and if they're moving from Dublin to Kerry, they might ask for the records to move. You'll receive that via a PDF on email, and we can upload that straight into the app, into Cushla. We pass that into the different consultations and share that. And then finally, we have the kind of old-fashioned take a picture on your phone and save it, and you tag what kind of treatment note it is.
And from a research perspective, how has this solution been received by healthcare professionals?
Yeah, it's been really positive. I think it's easy to sometimes think that your healthcare teams see this as just more pain on top of their existing day, and I think that was one of the points that came out, again, through some of the more recent reports, is a fear that digital data and the prevalence of information being made available to you just burns more time. And I think what we're trying to do is show that it's the other way around. So if you take the couple of pilots that we did, and we alluded to some earlier on there, we've got the ability to make the appointments, and a lot of people are now going to online appointment booking, but we're also doing the triage questionnaire there. So rather than wait until you get in front of the doctor or the consultant or the physio to tell them why you're there and what's happened, you can share that information in advance. It takes a couple of seconds for the person to read it, but you can spend the time explaining the reasons behind your visit. And it means that the treatment notes then get shared back very, very quickly, because everybody pretty much does treatment notes into an electronic system. GPs, consultants, physios, they all use electronic platforms. So they might take the note on paper, but then transfer it into an electronic record anyway. So we're saving time both in the appointment, fielding calls, time being wasted waiting on a call or waiting for a response, picking times that suit you as opposed to being given a slot and then having to change your day around. So the feedback has been largely positive, which is great, and just looking forward to that carrying on and these pilots moving into to full rollout.
And of course, before we discuss the pilot that you're currently undertaking, I'd like to speak to you about the operational element of this business, specifically in relation to the integration of your system with that of, let's say, a hospital or a private clinic's system. Are you finding that their systems have APIs and are open to integration?
Some do and some don't, I think it's fair to say. And again, I mentioned that in the US, the regulation is very strict there. You must exchange information via a particular format within a certain time frame. And that took a few years to get to, but it's now absolutely mandatory. In Ireland and across Europe, that isn't as mature yet. And again, the HICWA report called out this digital decade to make that available by 2030 for all EU citizens. And I think that's, it's achievable. It's going to be tough, but it's achievable. But the basic framework of a message is exactly the same where you go. So if you go into hospital, there's an admission message, there's a transfer message, there's a discharge message, and they're generally produced in the same way. And they're made available between the system that's used in accident and emergency into the overall hospital's patient management system. So those formats exist, and that's similar to the way open banking went and SWIFT messages and so on. That structure will be rolled out, and it will be just transferred in a more modern architecture. So the integrations are there. All hospitals will have the ability to move across, but there is effort involved there. And I think that the key thing is, in the past, is an assumption that you integrate from all hospitals to all hospitals and all healthcare facilities. And what we're trying to do is say, well, that framework isn't necessary. The messaging is what needs to go to the patient and be made available then to the other facilities. And that's really where Cushla sits as a place to centralise the information for you, but for you to share it under your consent to whichever healthcare facility you're going to next.
The Cushla app is currently being piloted in St Michael's Hospital in Dunleary in Dublin. But what does the pilot entail, and what type of feedback have you received to date?
Yeah, we have a few pilots going on, and the one that you referred to there with St Michael's is part of the HSE and Department of Health Innovation Hub Ireland Award. So we were really grateful to be selected as one of the winners for 2022 for that. So what we've proved there is that within the outpatient physiotherapy unit, that they can receive the appointment online, that they can do the triage online, receive the treatment notes back, and receive any exercises. And what we're proposing to do there is extend that beyond the outpatient physiotherapy into the A&E unit as well. So a lot of referrals into outpatient physiotherapy start in the emergency department. So we're looking at the admission message into A&E, the discharge message from A&E into the physio, and then that existing route for physio as well. And we've done a couple of pilots with other physiotherapists outside of the HSE system just to prove that it works the same way in a private setting. And we've done pelvic health physiotherapy as well, again in a private setting. So just proving that the same flow works.
And of course, while access to healthcare information and control over who has access to this information is shared with has become extremely important, data security is also of utmost importance to people. So how does the app ensure that an individual's medical information, that sensitive information, is not compromised?
It's the hub of everything really in this space. People are worried about their personal information being lost, and there's nothing more sensitive than your health information. And when we started to build the product, the first thing we did was we brought in people from Microsoft and our own guy, co-founder, who's an information security officer, and we designed everything from the premise of data sharing, which is enshrined in GDPR for the EU, but HIPAA in the US and other equivalents around the world. So the concept of privacy by design and data security and all the encryption layers that we have are all there. And the great thing about Microsoft, I've worked with them a lot over the years, they've got an entire framework around health data. They obviously provide the platform for a significant number of the health facilities, HSE, NHS and so on. They're fully compliant with all of those requirements, and we're sitting on top of that. We're using their services. So we host everything within Microsoft Azure. We've got all of the HIPAA compliant security services around the product, and we're continually testing it as we're designing it and making sure that we meet all of the criteria around encryption. But I mean, that makes it a very technical answer, but the reality is you have to trust the product. And there are many places where people need to just get comfortable around health data being stored in a central solution, and that's where Cushla sits. We're keeping this information for you. We're not taking this data off and selling it and using it. And I think people have a right to be scared about those type of processes, and we've seen those with other things in the press recently. What we're doing is keeping everything for you. The only time that you can see the information in there is when you've put your biometrics or fingerprint or whatever there. The rest of the time, the application all of that information is encrypted, and it's split from your identity as well. So you need to put your fingerprint in to bring, or your face recognition or whatever, to bring that information together so it becomes identifiable to you.
You're currently in the process of raising €3 million of funding. Talk to us about the source of these funds and how this investment will be used to grow the business.
Yeah, we kicked that off probably when we were starting to look at this around a year ago. We started to raise just enough to let us start, and that got us to where we are today. And we've gone back to that same pool. So largely it's individual investors. It's all private equity as well in this round. So people that have been involved in medtech startups before, we've reached out to a network. We've been fortunate to get a great partner involved who's introduced us to a great network there, and that's brought in people who have a good familiarity with health tech and medtech, and they've put in significant investment there. And we've also got the EIS this time around as well.
And finally, Richard, what are your long-term growth plans for the business?
There's significant opportunity for us both in Ireland but also internationally as well. We've a business development arrangement and doing a little bit of work with Enterprise Ireland both in the US and in Asia to help with that regard as well. So I think for now, we have to be realistic. Today's challenge is getting up and running and getting the pilots signed off. We've kind of got 3-month windows to prove the point. Both here with the HSE and in the UK with the NHS. And then it's a case of trying to make sure that what we've developed there is scalable outside.
Well, if you've just tuned in, that was Richard Egan from Cushla, and we look forward to this becoming a mainstream business over the months ahead once it exits the pilot stage. After the break, David Maxwell from Further Space reveals how it is partnering with landowners on a profit share basis to grow its glamping business. So do stay tuned for that.